here to tell you that it is possible to be happy and to be a nurse at the same time. The purpose of this channel is to get you to the place where you can achieve happiness and be a nurse simultaneously. Let me introduce myself. My name is Deanna, and I've been an RN for almost 38 years. I'm currently working as a staff nurse in a general ICU in the Philadelphia area. I have 2 master's degrees, one as a clinical specialist in critical care and another as a family nurse practitioner. As you know, the field of nursing has opportunities in many different specialties, and I took advantage of that. I've been through a lot of roles in my career, and I'd like to share them with you. My past roles include a clinical nursing instructor, heart transplant coordinator, staff nurse in CT surgery, medical writing and editing, agency nursing, critical care education, and practice nurse in the maternal fetal medicine office. So I've done a lot of different things. Proud of that. It's made me who I am today. It's given me a chance to learn new things and, of course, help people, which is what we should all be about. So I'm licensed now as a family nurse practitioner and looking for a possible change in my career from staff RN to nurse practitioner. Now, right now, I'm not sure if I want to do acute nurse practitioner or family medicine or outpatient nurse practitioner. So I'm deciding that right now. Enough about me. In these videos, I'd like to share with you ways to improve your work life as well as your personal life. And to accomplish that, I would like to first point out what I find as a fundamental way that I prioritize my life, which helps with keep me happy, and that is my faith first, myself second, my family third, and my community fourth. They're all important and they all need to be addressed numerously. As a spiritual person, I try to live by one philosophy, and that is that I work for God, not for people. And this gets me through my day-to-day work as a staff nurse. It means that I'm answerable to my Creator, who knows what I'm doing at all times. I don't slack off because my supervisor or manager are not watching. And I don't leave things undone because it's not my job. Even if it's not my patient, doesn't mean that I can just walk past the room and ignore them. They are still people. They are here. They're in the hospital to get help. If you work at an outpatient center, you know that people come up and ask you questions, and we generally, as caretakers, we have the will or the need or want to help people. I know it's difficult on an inpatient unit when everybody's very busy to ask for help, to get help. But once things settle down a little bit, if you're caught up in what you're doing, asking others if they just need a hand, even if they say no, which in my experience, most of them do, it's nice. They think it's nice that you ask, and I believe it makes me feel better, and I think it helps the other person feel better, and it keeps the staff cohesive. Now that I've introduced myself to you, I'd like to share with you some topics or things, categories that I would like to go over in these videos to help make you happy as you're a nurse. And the subjects that I've come up with are scheduling your morning and your evenings, so before work and after work. That's the next video that's going to be coming out next week. Like to talk about self-care, we can talk about fitness, we can talk about skincare, beauty, strategies to help with stress. And if you have any other topics you'd like to share, please share them with me, and we will hopefully get to those. So I'm planning on having these videos come out on a weekly basis so that you and I can share with each other how we get through these difficult times. I hope that you will follow me and please contact me. Let me know what you're interested in, and I will give you some of my experiences from the last 38 years as a nurse. Especially for new nurses, I have a lot of thoughts about that, because it is difficult being a new nurse. You're learning how to be a nurse and do all the clinical things, but you also need to think about the staff you work with, the patients' particulars that they can't really simulate in the sim lab, and all of those kinds of things. So please write me, get in touch with me. I would love that. And I will see you next week. And again, we're going to be talking about scheduling your mornings and evenings for self-care, mornings before work and evenings after work, or if you work night shift, evenings before work and mornings after work. It works both ways. All right, thank you, and we'll see you next week. Bye.